watching Let's Chat.
Over the past number of years, you have heard us talk about Volunteers in Medicine as well as Project Access. Now, the two of those charities are coming together and doing an incredible golf tournament, and they want you to get involved. Joel Henderson is with Volunteers in Medicine. Kevin Lusk is with the Southeast Tennessee Project Access. Gentlemen, and no, I don't use that term loosely. Good morning to you both.
Good morning. Thank you for having us.
Tell us what your charity, which is Volunteers in Medicine, and yours, Project Access, what do they do for the communities?
Sure, absolutely, and thank you. So Volunteers in Medicine, we serve the uninsured, the working poor. If folks 19 to 64 adults do not have access to a primary care medical home, please find us, help you stay healthy, get healthy, and be healthy. That's what we do with the primary care, working in partnership, which Kevin will talk about, with Project Access.
And we use this term before we begin. Think of our organizations as cousins, so to speak.
Yeah.
They do primary care. Volunteers in Medicine does primary care. Project Access does specialty care. So we receive referrals from our partners like Volunteers in Medicine, primary care partners, and those uninsured patients come to us, and we help find, it can be for any specialty care need, it can be anything from a broken bone to cancer, and we help find a specialized physician that helps provide the care that patient needs at absolutely no cost to that patient. So we provided over $217 million worth of donated healthcare services since this program started back in 2004, and it's with partners like Volunteers in Medicine that we're able to work together to do that.
Any idea between the two of you how many patients you have been able to serve over the year? $217 million is incredible, but how does that break down into person A, B, C,
I'd say it's been in the double-digit thousands for sure.
Has to have been.
Yeah.
And in Volunteers in Medicine, I mean, we've this past year gone over 76,000 patients.
Oh, okay.
Wow. Which
there
for
you
us
go.
in primary care, that's over $110 million as well. So those are, besides the numbers, you think about those stories. I always say, every time I see a help wanted side, those are our patients. They're either trying to keep that job, get that job, because it really is the working poor. And as Kevin said, I never thought to put up a billboard say we do free health care. Simple says that sounds too good to be true, but we do health care at no cost for our patients.
Right. And you got to give a big round of applause to the doctors, physicians, the nurses who are all chipping in to help both of your respective organizations.
Right. I mean, they have the passion for it. They went into healthcare to help people, and a lot of these folks were doing charity healthcare anyway, and we provide an official avenue for them to do it in the best way possible, most streamlined way possible to help the patient, but also help the primary care or specialized provider.
All right, tell me about the golf tournament that's coming up. How did you guys decide to come together and do one big, massive tournament instead of you doing yours and you doing yours?
Sure. Well, coming out of the pandemic, a lot of things have changed. And one of those things that have not changed is we work so closely together. We said, wouldn't it be cool if we did a fundraising event together? We've both done golf tournaments annually, but instead of doing them separately and competing, we collaborated together on Friday, September 16th at Brown Acres to do something that's really fun and create funding for what we do.
Right, and it'll be a full-day tournament, so we have an AM flight and a PM flight, and a team is only $500. So if anyone was interested in that, they can do a foursome for $500. It includes cart, includes the round of 18 either the morning or afternoon. It also includes lunch that we have generously donated from El Mason, and we'll also have breakfast and snacks afterwards for the afternoon. So just a fun day of golf, and the weather's going to be perfect that day because you've already told me it will be.
Absolutely is. What about sponsors and volunteers?
Absolutely. So we're fortunate right now, can I say, we've got VIC, March Adams, Capital Toyota. So we've got some great sponsors. We have more opportunities, though, for additional sponsorship at different levels. So go to either one of our websites, and there's more information to contact us to become more involved.
Right. And chatmd.org is our website, and yours?
vim-chatt.org is ours.
It's certainly great talking to both of you about this, but I want to step back to the health care you provide in just a moment, and we'll show you more on the tournament itself here in just a moment as well. It's not just for folks in Hamilton County who are eligible for this free health care, correct?
That's right. That's right.
How far does your net cast?
Well, Project Access originally was started in Hamilton County, and we recently just just expanded into Bradley County, and we're getting ready to expand into other counties that border Hamilton County and actually Polk County as well. So we're throughout all throughout Southeast Tennessee, and we've just expanded those services in the last 12 months. The pandemic slowed us down a little bit, but
Sure.
we're ramping back up, and we have physician volunteers in those other counties, and you cover
Absolutely. And so
the
as you can
same
imagine,
area.
whenever folks finally, the transportation challenges, if they get to our clinic, they come from boundary counties. We do
Right.
not turn them away. The need is great, and we try to provide that care for folks. Even though we're based by Eastgate Mall, that's where our clinic is, you better believe that's a couple miles, even from North Georgia.
Sure.
So we serve our area
All right.
in need.
Joel, Kevin, good to see you both, and we'll talk to you between now and the 16th. And again, it's going to be at Brown Acres on September the 16th. What day of the week is that?
That's a Friday.
That's a Friday, so
Perfect
start
day.
the weekend early. Find out more by checking out the website. It's certainly two wonderful organizations for one great day of golf. We'll be right back after this.